Bismillahirrahmanirrahim. Assalamu alaikum. Assalamu alaikum, everyone. Today, my seminar is about the mediastinum. The mediastinum is a partition between the right and left pleural sac, and it excludes all structure which lie in the intermediate compartment of the thoracic cavity. As you see in this diagram, the mediastinum divided to the superior and inferior part by the thoracic plan. This is the artificial horizontal plan from the mandibular sternal angle up to the down to the lower board of end plate of the T4, divided mediastinum to the superior and inferior part. Inferior mediastinum divided to the anterior, middle, and posterior part. The superior mediastinum contains aortic arch and its branch, brachiocephalic vein, and superior vena cava, trachea, esophagus, thoracic duct, lymph node, and the nerve. Anterior mediastinum contains the thymus, mammary vessel, lymph node, and sometimes, if it is retrosternal thyroids, may contain some part of this gland. The middle mediastinum contains the heart, pericardium, nerve, lymph node, and the great vessel. According to the posterior mediastinum content, there is a descending aorta, esophagus, azygous venous system, thoracic duct, para-aortic, esophagus, and paraspinal lymph node. Here we see the CT section, sagittal and axial section of the thorax, showing the mediastinum. The purple color showing the anterior mediastinum, middle blue color showing the middle mediastinum, and the yellow color showing the posterior mediastinum. This view showing the axial section of the CT at the level of the aortic arch, the anterior, middle, and posterior part of the mediastinum. Here also CT axial section at the level of the pulmonary artery and level of the left atrium, showing the anterior, middle, and posterior division of the mediastinum. Now we talk about the aortic knuckle. It's formed by the posterior part of the aortic arch, and it may be indystenic in young people and very prominent in older people due to the aortic unfolding. As you see in this X-ray, this is the aortic knuckle. And aortic nipple is seen in about 10% of the frontal view chest X-ray and lateral surface of the aortic arch. It represents the left superior intercostal vein draining to the left brachiocephalic vein. If it's become more prominent, we have to remember it may be due to the superior vena cava obstruction or absence of the azygous vein. Diagram of the 3D reconstruction from the CT showing the passage of the subcostal vein to the brachiocephalic vein. Now, aortopulmonary window. As you see that in the lateral and frontal X-ray, at the area of the passage between the aortic arch and pulmonary artery, it should be radiolucent area. Just you see here as the yellow color. It should be concave. But if it's become more prominent and becomes straight or convex, you have to consider differential diagnosis, just like the lymphadenopathy, prominent mediastinal fat, aortic and bronchial artery aneurysm, and malignancy. In this picture, after more investigation and taking CT and biopsy, the result was the mediastinal seminoma associated with the multilocular thymic cyst. Lymphatic duct. At the right side, we have the lymphatic duct, and at the right side, lymphatic duct, and at the left side, we have the thoracic duct. The thoracic duct arises from the circular lymphatic reservoirs sternochyli, which lie behind the right crust of the diaphragm and near to the body of the L1 and L2. Then it's run to the posterior mediastinum, passing through the aortic opening at the level of the T12, coming to lie to the left of the esophagus at the level of the T5, and pass laterally behind the carotid vessel, and at the level of the C7, the duct arch anterior over the left line, rising 3 to 4 centimeters above the clavicle, and then drain to the descent, descend to the drain to the left subclavian vein at jugular subclavian junction. The left side receives the lymph drainage from the left thoracic as well as the left side of the head and neck and left subclavian trunk, which drain from the left arm, and the lymph from the abdomen and leg that drain from the sternochyli. And the right lymphatic duct, it's become drainage of the confluence and drainage of the right jugular trunk, right subclavian trunk, and right brachomediastinal trunk. Right jugular trunk drain the right side of the head and neck, and right subclavian trunk drain the right arm and right half of the thoracoabdominal wall, while the right brachomediastinal trunk drain the hemithorax, including the right heart and right lung and part of the liver. Middle mediastinal lymph node. If you remember at the previous lecture, we talked about and say that lymph node are named according to the anatomical position, just like the bronchopulmonary lymph node, carinal lymph node, tracheobronchial, right and left paratracheal. It's been the lymph node along the trachea. Azygous lymph node, pretracheal lymph node mean that lymph node anterior to the trachea, and aortopulmonary lymph node. Thymus. Its organ. This organ is part of the lymphatic system and lies in the anterior mediastinum. It has two lobes, the left larger and higher than the right, that extend down as far as the fourth costal cartilage in infancy. It is important to remember that it is visible at the chest radiography within 24 hours of birth and gradually involuting after 2 years. It's rarely seen at the chest radiography after the 8 years of age. Thymus may protrude from the middle mediastinum, from the mediastinal contour on the anterior mediastinal contour on the right or the left as the cell sign. It typically has a clear line lateral to it. Normal thymus never deviate normal structure. Normal thymus, as you see here, different presentation. At this picture is just like the cell line, here as like the consolidation, picture B just like the consolidation, and picture C is just like the intestinal mass, and the diagram C just like the cardiomegaly. ultrasound and the CT. العفو استاذ صوتي واضح؟
بالي واضح، بس شوي سريع دا تمشين على كيفك.
تمام. Ultrasound, as you see in this ultrasound, it's a hypoechoic in comparison with lower part of the normal thyroid gland. إذا تشوفون هذا المؤشر الأصفر هذا thymus، واللي مثل نجمة هذا thyroid gland، يعني يكون hypoechoic in comparison with the thyroid. وبس CT it's homogeneous and similar density just like the surrounding the muscle. At the MRI, at the T1 and T2, it's signal higher than that the muscle. Azygous system. In the right side, we have the azygous vein, and in the left side, we have the hemizygous and accessory hemizygous. Azygous vein. This vein is found in the posterior mediastinum, and system consists of the azygous vein on right and hemizygous and accessory hemizygous on the left side. The zygous vein commences is variable anterior to the L2 vertebrae, either as a branch of the inferior vena cava or as confluence of the right ascending lumbar vein and right subcostal vein. It's ascend to the right of the aorta and thoracic duct, anterior to the body of the T12, T5. At the level of the T4, a zygous vein arch anterior passing over the hilum of the right line is drained to the superior vena cava behind the third costal cartilage. A zygous vein receives all but the first intercostal vein on the right. The second, third, and fourth intercostal vein usually drain via the common channel, the right superior intercostal vein. Hemizygous and accessory azygous vein drain to the zygous vein at the mid-thoracic level at the vertebra of the T8. هاي vertebra of T8 الليفت سايد يكون درينج متى للرايت سايد، يعني كلش مهم هاي T8. The right bronchial vein drain into the azygous vein near its termination. It's also received tributaries from the esophagus, pericardium, and the mediastinum. Hemizygous. Its chromosis is similar, just like the azygous vein. At its origin may communicate with the left renal vein and descend anterior to the vertebral column to mid-thoracic level. Then it's behind the aorta to drain into the azygous vein, as we said previously at the level of the T8. It's received the left ascending lumbar and lower fourth posterior intercostal vein, as well as the mediastinal and esophagus vein. Accessory hemizygous vein is received 4 to 8 posterior intercostal vein, And the first to third drain into the left brachiocephalic vein. Its descent on the left side of the vertebral column to mid-thoracic level, then cross behind the aorta to drain the azygos vein, يعني تقريبا at the level of the T8. This is the axial CT thorax with contrast to show the zygous and hemizygous system of breathing. بالpicture A we see the zygous arch, and the picture B نشوف
أشري بابا أشري.
بل هذه zygous arch picture A. Picture B نشوف drainage of the accessory hemizygous يعني at level of the T8. شوية يعني below it يكون drainage مال confluence مال the hemizygous vein, and the lower at the picture D, zygous and hemizygous vein before confluence. Mediastinal line. Right paratracheal strip is as we see in the frontal chest X-ray, it's a radio-opaque line. Showing it's become due to it's formed because of the presence of the air in the trachea medially and air in the parenchymal line in the laterally. It's radio-opaque line and should be less than 3 millimeter. Posterior tracheal strip as the lateral view chest X-ray showing the radio-opaque line, and it should be less than 3 millimeter. And the axial section, posterior tracheal strip, should be less than 3 millimeter, but if the esophagus is collapsed, it may reach to the 1 centimeter. Anterior junctional line, the line is formed by the opposition of the line anteriorly. It begins below the clavicle. And run inferiorly and to the left side is always end in the right ventricular outflow tract, as you see here in the chest X-ray, right, anterior junctional line, and the axial CT also see the anterior junctional line. Posterior junctional line formed by the opposition of the two lines posteriorly extend from the well above the clavicle, line above the clavicle, radio-opaque line above the clavicle, and vertically downward to the arch of the aorta. This line represents the four layer of the flora between the posterior part of the line seen from the front. Paraspinal line are outlined by the line opposing to the spinal column. The right line is more sharper than the left because of the presence of the aorta on the left side. It should be less than distance from the lateral border of the spine to the line may vary with the body habits and may be 1 centimeter on the left in the obese people with the paraspinal fat deposit. Widening of the paravertebral soft tissue on the right is always abnormal. And CT at the level of the T3, we see here the third vertebral body, trachea, esophagus, this is the body of the sternum, and the right common carotid and subclavian artery, left common carotid and subclavian artery, and the right brachiocephalic and left brachiocephalic vein. At the level of the T4, we see the vertebral body of the fourth vertebrae. We see the aortic arch, trachea, and partially collapsed esophagus, and the superior vena cava and azygos vein. At level of the T5, you see the body of the fifth thoracic vertebra. We see ascending and descending aorta. See also the main pulmonary artery, right pulmonary trunk and left pulmonary trunk. Of the trachea and trachea bifurcation at the carinal level, and they see the collapse esophagus.
شكرا جزيلا دكتورة حسنى. نطلع حسنى. نختار دعاء الطائي. Name the approach structure. Name the approach structure. دعاء.
Thymus. This is thymus.
Thymus. ضرغام.
نعم أستاذ.
Name the approach structure.
استاذ هذا الازايجس باين.
This is the esophagus vein. هذا طبعا more posterior section in coronal CT. اوكي.
حلو أستاذ، خلصنا دكتور، بالسؤال إن شاء الله.
بس سؤالين اوكي. عايشة تيجي. اكو احد بعد عنده سؤال او اضافة؟ ماكو.
بس العفو استاذ، الهيمازايغوس وين نشوفه بالسي تي لو بس يعني بس الازايغوس؟
يعني